And then,
Hi, my name is Emily. I'm going to be your nurse today. Can you tell me your name and date of birth?
Houston House 10/6/08.
Okay. And can you tell me where you are today, Kirsten?
Hospital
And do you know what today's date is?
4/17/2020.
Okay. So what I'm going to go ahead and do is do a little assessment on you since you came in for the second time with some abdominal pain, and then we'll go over a little bit of information from your last visit and what we're going to do differently this time to help you get better, okay? All right, I'm going to go ahead and have you look over, all right, look your other direction. All right, no JVD. All right, and I'm going to, any pain in your upper extremities other than your stomach?
No.
No, okay. And you said your pain was what out of 10 for your stomach?
6.
And does it go anywhere?
No.
Okay. And when did it start?
3 days ago.
Okay. And does it radiate go and get any worse? No. Okay. So I'm going to go ahead and assess your arms really quick for me. Your arms are warm, pink, and dry. She doesn't have any IVs or catheters, so I would double check that those are patent and make sure that there's no tubing that's kinked, and watch for her route to the bathroom to make sure that there is nowhere that's obstructed, causing her to be able to fall. Her catheter would be hooked to an immovable part of the bed, which she doesn't have one, so that is that. I'm going to be giving her IV as soon as I get done with this assessment, so I will just make sure that her IV pool is where she's able to walk to the bathroom with it and she's not having any kinks. So I'm going to go ahead and listen to your lung sounds, okay? All right, go ahead and lean forward for me. All right, go ahead and relax. I'm going to go ahead and look at your stomach for you. Her stomach is flat. It's not distended. It is soft. Are you having any tenderness in your stomach?
Yes.
Yes? Okay. So I'm going to go ahead and listen to your stomach, and then when I palpate, just make sure you let me know if it hurts too much. When was your last bowel movement?
Yesterday.
Yesterday? Okay. All right, so her lung sounds are clear, her heart sounds are normal. She does have vowel sounds times 4. So I'm going to go ahead and have you push on my hands and pull on my hands. All right, awesome. I'm going to go ahead and look at your legs. It doesn't look like you have any edema in your ankles. Your legs are warm, pink, and dry. And she does have socks on, so I'm going to go ahead and remove these socks to be able to look at her cap refill on her toes. And it's less than 3 seconds. All right. So I'm going to have you push down on my hands and pull up on my hands. All right. Awesome. So you came in and you had some, you had said you had irritable bowel syndrome because you had been told that before. You had some bloody stools. So we looked at your CBC, your colonoscopy, and your occult blood. We did give you some instruction to make sure that you are limiting the amount of irritating foods, drinking plenty of fluids, and report any abdominal pain and bloody stool, which you did because you did come back to the ER. You had 2 bowel movements yesterday, and you've already had 5 today. So that kind of puts a red flag for us. So we're going to go ahead and repeat your colonoscopy, and we're going to draw up some ESR and CBC labs, okay? We are going to give you some Bentyl IM QID. So can you tell me your name, date of birth?
Houston House 10/6/08.
Okay. I'm going to go ahead and double check your wristband to make sure that is right. All right. So we're going to go ahead and give this to you IM, which is intramuscular, so we can go ahead and use any muscular part on your body. And we could do, if you would like, you can do in the back of the arm. If you would like, you could do on a not such fatty part of your thigh if you would like. Any spot that you feel that's very muscular is okay, as long as you're not getting it intradermal or not in the muscle, because it could be very irritating. So things to watch for is making sure that if you have any headache, any blurred vision, dry eyes, dry mouth, those are some common side effects, some constipation. And the reason that we give this is for irritable bowel syndrome, okay? Since that is not working, and we are going to more than likely rule out irritable bowel syndrome because we could think it's inflammatory bowel disease, and we think this because you're having so much bloody stools, you're having that abdominal pain, and it's causing inflammation. So what you could expect now is to be sent home with some corticosteroids, and what those do is to decrease inflammation. And then we also want to give you antidiarrheals because it's going to help prevent those little stools causing that more inflammation, okay? Do you have any questions for me?
No.
No? All right, so I'm going to go ahead and let you go. That's pretty much all I have. I'll be right back in to start your IV. But until then, go ahead and relax, and I will be back, okay?